HealthCare Community Connection is sponsored by UK HealthCare.
I'm joined by Dr. Stephen Stroop this morning. He's here to discuss the importance of screenings and signs of prostate cancer. Good morning, sir.
Good morning. Thank you for having me.
Thank you for being here. Let's talk first off about the early signs. What are those?
Well, the problem with prostate cancer is often there's not a lot of early signs. And if you're having early signs of voiding dysfunction and so forth, usually that's a worrisome sign for more advanced disease. Most urinary symptoms are from a benign growth of the prostate. So from a cancer standpoint, there typically aren't a lot of signs.
For people out there going, what's the process? What does a prostate cancer screening involve, you'd say?
I'd say typically it's a blood test and then a physical examination of the prostate. So those are the two stalwarts of screening.
How often should men have this taken care of?
Generally yearly, and it's not something you do, from a very young age. The screening guidelines typically start at 50 for those of average risk. That means you're male and have a prostate. If you have higher risk, such as a family member, a first-degree family member with onset of cancer at a younger age, then you find that your prostate screening should probably start around age 50, 45 to 50. If you have very high risk, African American population, more than one family member with prostate cancer, you should probably even consider starting in your 40s.
Overall, how has Markey as an NCI designated comprehensive center had an impact on not only research but treatment as well for this?
Well, as a national cancer center, a comprehensive cancer center, we have access to a lot of trials, and so a lot of our trials are geared towards advanced disease and also research, looking for those mechanisms, understanding prostate cancer. The goal is to make those discoveries and then move them into the clinic, find something that we can use to treat patients directly, and those are that type of program from drug design, trying to find things that will work against cancer, cancer prevention. All of those things are part of the Comprehensive Cancer Center.
Obviously, cancer is a very scary word for everybody, but in terms of this kind of cancer, a lot of great strides being made.
Yes, and sometimes the best strides are understanding the disease, knowing what to treat, when to treat. Not all prostate cancer is treated. There are some low-risk cancers that we actually follow, and I think that should be something that people are very much aware of. We're understanding more about which cancers are at risk. Our treatments are evolving, and we do many of the same things we've done for many, many years. We just do them a little better, whether that's radiation, surgery, and so forth. So, yes, it's moving the field forward. We'd like it to go at a rapid pace, but it tends to move a little bit more like a glacier. So,
well, we appreciate the information, appreciate all you and UK HealthCare do toward this disease and making it more, better for people out there. Obviously, huge strides, and thank you.
Thank you.
All right, that's Dr. Stroop from UK HealthCare. We have 30 more minutes of news right after this.